Hello, my dear friends. Welcome back to Fit Seniors, the place where we talk about health problems that affect our daily life, especially as we grow older. Today's topic is something I hear about almost every week, especially from women. My hands go numb at night. Maybe you felt it too. You lie down to sleep, and suddenly your hand feels heavy, tingly, or completely numb. You wake up, shake it, move it around a bit, and after a few moments, it's back to normal. Sounds familiar, right? Many people think it's poor blood flow or sleeping on the arm. But in many cases, it's something called carpal tunnel syndrome, or CTS for short. What's really happening? Let's keep it simple. There's a nerve that runs from your arm into your hand. This nerve gives feeling and movement to your thumb, index finger, middle finger, and part of your ring finger. At your wrist, this nerve passes through a small space called the carpal tunnel. It's like a narrow passage made of bone and a strong band of tissue. Now imagine what happens when there's swelling or extra pressure in that small space. That nerve gets squeezed, and that's what causes the numbness and tingling you feel. When and where it happens, most people notice it at night. You might wake up with your hands tingling or half asleep, or maybe while using your phone, typing, or chopping vegetables. You suddenly feel your fingers going numb. And if you look closely, you'll notice that the numbness usually affects the thumb, index, and middle fingers. Your little finger, the pinky, usually feels fine. That's an important clue because that finger has a different nerve supply. Who gets it? Most carpal tunnel syndrome is more common in number 1, women over 40. Number 2, people who are overweight and are pregnant women, and anyone who uses their hands a lot, like typing, sewing, cooking, or lifting. Even small repetitive hand movements, done for many hours, can cause the tissue around the nerve to swell, putting pressure on it. How you can test it yourself. There are a few simple checks you can do at home. Try this. Bend your wrist down like this and hold it for about 30 seconds. If your hand starts tingling or going numb, that's a sign. Or you can try this method as well. Tap gently on the inner side of your wrist, right where your hand meets your arm. If you feel a sharp tingle or electric feeling going into your fingers, that's another sign. But of course, the best way to confirm it is to see your doctor. They might ask for a test called EMG or nerve conduction study. It's a simple test that checks how well your nerve is working. What you can do about it. Now let's talk about solutions. And don't worry, most people get better with simple care. Rest and wrist support. Try to avoid overusing your wrist. If your job or hobby involves repetitive hand movements, take short breaks. At night, you can wear a wrist splint that keeps your hand straight. It gives the nerve more space and helps reduce pressure. Exercise and physiotherapy. Gentle stretching and strengthening exercises can help a lot. A physiotherapist can show you how to keep your wrist flexible and improve blood flow. Reduce swelling. Sometimes your doctor might prescribe mild medication or suggest ways to reduce inflammation, like cold packs or adjusting your hand position. Lifestyle changes. If you're overweight, even a small weight loss can help relieve pressure on your nerves. And for pregnant women, don't worry. Symptoms often improve naturally after delivery. Surgery, only if needed. If the nerve has been compressed for a long time and nothing else helps, a small surgical procedure can be done to release the pressure. It's a short operation and gives excellent relief in most cases. A small but important reminder. Not every numb hand means carpal tunnel syndrome. If only your little finger or part of the ring finger is numb, then it's probably a different nerve, not the same one. So don't jump to conclusions. Always check with a doctor before assuming it's CTS. So, my dear friends, if your hands go numb at night, don't panic. You're not alone, and it's usually treatable. Listen to your body. Take breaks. Stretch your wrists And if it doesn't go away, get it checked. Early care can prevent long-term damage. I hope today's video helps you understand your body a little better. If it did, please take a moment to like, share, and subscribe to Fit Seniors, where we keep your golden years strong, healthy, and active. Stay gentle with your body, stay kind to yourself, and I'll see you again soon.